We see these wonderful people, Paul White, Ancel Keys, and our colleague from Japan, Noboru Kimura, on site at the beginning of this very exciting period of study of diet heart around the world. We're at 1957 in southern Italy, Nicotera, where the first test of this theory took place. The theory that was being tested in the 7-country study was that differences in the quantity and in the quality or the type of fat were the determinants of the serum cholesterol levels, which in turn was a determinant of the heart attack risk in these populations. We get a flavor of this beginning, very exciting international adventure in medical science.
You've repeatedly said that dietary fats are important in the development of coronary heart disease.
This is a national TV panel discussing the diet heart issue, whether there's a relationship between habitual diet of peoples and their cholesterol levels and their heart attack rates. And it pits Ancel Keys, the central figure here, and his colleague Paul Dudley White, distinguished cardiologist, against Ed Ahrens and others discussing this issue at a very early stage.
Well, now I understand that you and Dr. White have made a trip to southern Italy. Is that correct?
Well, Dr. White and I have had a lot of trips together, and the most recent one is only a few days old. As a matter of fact, we interrupted the field investigation that took us to southern Italy and then to Crete. I came back only a couple of days ago, and a ground-round camera crew accompanied us to Calabria in southern Italy. In southern Italy, we had the possibility, so we thought, for various local circumstances, of seeing all the men of a whole population. So we could, for the first time, talk to some degree of accuracy about the actual condition, both medical and with regard to diet, of all the men in a community. In Italy, where we've worked previously, we have found evidence as to frequency of the disease, but here we were trying to get all of the condition. And as you remember, Paul, in our work there, we had to go and scout out some of the patients as well as having them brought to us.
As Dr. Keys has said, we made studies of the population, the total male population, 45 to 65, in these two towns, one in Italy and one in Crete. And we studied not only the dietary situation and the examination, but also the physical activity of these people, the amount of tobacco and alcohol they use. And as far as we could, heredity. And I want to put in a plug for heredity right now. We must pick out the candidates to whom we should apply these programs once we find out what the programs are. In these pictures, you see us going to different places. And here we are in a wine cave, where the men are treading the grapes. And we went in to ask them to be examined, to come to the laboratory to be examined. But they told us that they were too busy for the moment. But at that time, we made contact by asking one of these men to come down. Professor Pudu of Rome was our interpreter here, and one of these men came down to be examined. And when he'd sat on this tub in the cave, Dr. Pudu called Dr. Keys and myself in, and we examined this man and thereby made contact, and he agreed, after the grapes had been harvested and the wine made, to come for an examination. Here we are examining this patient. And you will see that...
Sounds all right, it does. But of course he must have an electrocardiogram and a blood test.
You're not assuming in the cobra, don't you think, after the taking of the wine?
Yes.
Some of these people were not well, and they couldn't come to the laboratory, and so we examined them at home. But here we are in the laboratory making some examinations, testing their physique, as well as examining their heart blood pressure and taking their electrocardiograms and blood for the tests, while others took the history, extensive histories, on these patients. We tested the skin fold, as a number of epidemiologists have done before. Dr. Keys, I think, introduced this in large part. And in this record, in this picture, you'll see Dr. Carlotti preparing a patient, Dr. Carlotti of Paris, preparing a patient for the electrocardiogram, which is being taken by Professor Kimura of Japan, Fukuoka, Japan, who joined our international team. And the record has just been taken.
Oh, yes, I agree. That's quite different from this record that was sent out earlier, senior corsos. I think this is normal, simply with somatic treatment.
This record was abnormal, showing bundle branch block, which we occasionally see, but most of the records were normal. On the other hand, we found a good deal of hypertension, and here I am in the room of a sick man with hypertensive heart disease, and I was getting his history through an interpreter. One of the local doctors acted as an interpreter, and another one took his history who knew this man, and with Dr. Kimura and Dr. Carlotti, we made the examination, and we found on occasion several of these men sick at home who were unable to come to the laboratory, but by and large they were able to come. We went to the hospitals too and examined patients, made ward rounds, examined patients there to see how much heart disease there was. There was a fair amount of hypertension, but very little coronary heart disease. Some rheumatic heart disease was found. But the examination was largely of normal individuals. And this is one of the few times, I think,
yes, I don't agree with you.
Males 45 to 65 were examined. They were finding the apex.
Yes. Well, we'll go ahead with the examination. I think he's got a hypertensive heart, but I'll see what we find on auscultation.
Hearing a murmur, which was associated with failure, a slight heart failure, we recorded this, of course, with the other data. And this information is to be available to us later for final analysis.
Thank you. Well, now, Dr. Keyes, let me come back to you and focus on our two questions again. You've repeatedly said that dietary fats are important in the development of coronary heart disease.
Immediately following the pilot survey in southern Italy, this international team boarded a plane for Heraklion on the island of Crete, where they met their Greek colleagues, and here they're seated around the table planning the strategy for examining Greek villages throughout the island of Crete. Here the team is selecting the villages to be representative of that traditional agricultural and fishing culture. The issue here was the remarkable characteristic of the Mediterranean diet in the Greek islands, which is high in olive oil, low in saturated fats. As you see, they move into the olive groves. And here we see the olives harvested. As you will see from the liberal application of olive oil to this salad, about 20 to 25% of the calories of these lovely islanders was, in fact, olive oil. Here Dr. Keyes and his family arrive for a very contrived greeting for the television cameras of the examining team. Professor Keyes, his wife Margaret, presented with the bouquet by a local child, and then they move into the city hall to begin the survey process. Professor Arvanis does the demographics. Look at this marvelous face, lean, wizened, healthy. Note the rather imperious way in which he beckons the next peasant to sit down. Beautiful faces of the old Greek papas. Professor Keyes and Fidanza do the anthropometry, that is, measurement of physical findings on the body. The subscapular skin fold, the biacromial diameter, the bicrystal diameter, reflecting male and female proportions. And here Keyes and Kimura take the first electrocardiogram on the first subject. The men wait in line to be examined very patiently. The roll is called. These men work hard in the fields till noon, take a long siesta, come back and work till early evening. Here Dr. Dontas examines the subjects between the ages of 40 and 59. He takes an ophthalmoscope and looks at the state of the blood vessels in the back of their eyes, checks the blood pressure and the heart size. A traditional farming, fishing culture with a very unique eating pattern. The group reassembles to discuss results. Dr. Keyes gives us a little lesson on electrocardiography. He loves to give such lessons. Dr. Fidanza showing a blood sample that's clear and a blood sample that's creamy as they conclude their discussions of the week's activities. This great adventure in the field prepared us for the more serious systematic undertakings that went forward for the next 30 years in the 7-country study. It demonstrated to us that we could gather together an examining team, train them in common methods, accompany them to the field, make a representative selection of the population, have 90 to 95, in some areas 99% response of that population to our entries, wide acceptance and pleasure at our visits to the island, gather the data, send it back centrally for blinded systematic analysis in Minnesota, and create a unique study of cultural comparisons and at the same time a study of individual risk as we followed these men over the subsequent decades, examining their heart attack and stroke rate in reference to their characteristics in health as we had measured them in the first examinations.